picture is clinical anatomy of the face, and as you have seen on the board, number one is what is known as trigeminal neuralgia. You are all aware that the face is being supplied by two nerves, the facial nerve and the trigeminal nerve. These are the major cranial nerves that supply the face. The facial nerve supplies the motor component of it. The trigeminal nerve, receives or carries informations with regard to sensation. Any type of sensation you can think of, ranging from the pain, temperature, proprioception, vibration sense, all these kind of sensations have been taken away from the face through the cranial nerve to the sensory cortex in the brain. So if you now hear this word trigeminal neuralgia, we are talking about the involvement of the trigeminal nerve that carries the sensory information from the face. Mostly this trigeminal nerve neuralgia, it is causing a lot of pain, because, it involves the trigeminal nerve. So it's the patient that has this trigeminal nerve or trigeminal nerve neuralgia, has what is known as excruciating pain. The pain is all over the face, and most of the time now the cause of this trigeminal neuralgia is unknown. Nobody can tell you clearly the main cause or causes of this trigeminal neuralgia. Mostly it affects individuals that are older by age, somebody who is 50, 55 and above. And mostly it involves or affects women, women of older age, those people that are above 50 years. So mostly once this happens, people with this kind of disease, they tend to have very, very much pain on the face. And the pain now results as a result of when you now try to do anything with the face. For example, if you want to talk, you feel the pain. Or if you want to, brush your teeth, early in the morning, you feel the pain. Or when you want to eat, you are just trying to chew something, like chewing gum or eating food, that is when you will start feeling the pain. Or when somebody tries to touch you on your face, you can also feel it. You get it? So all these are the triggers of this trigeminal neuralgia when somebody has that. So the pain is very, very severe in most of the cases. But some people, among them, they tend to have a very mild one. So the severity of the pain, depends or varies from one individual to another. So it may be mild in Mr. A, and may be moderate in Mr. B, and may be severe in Mr. C, something like that. And so, as I told you, this, the cause of this is barely idiopathic. Nobody can tell you clearly what causes this trigeminal neuralgia. But luckily enough, the trigeminal neuralgia can be treated. When you use analgesics like Brufen, all these non-steroidal anti-inflammatory drugs, what you call NSAID drugs. So this non-steroidal anti-inflammatory drug, what you call NSAID, so you can use them, something like Brufen, aspirin, catapholum, and so on and so forth. So you can use this one to treat, this trigeminal nerve neuralgia. But apart from that, you can also use some injectables. You can use some injections, in the areas, of the face, and so the pain can also get reduced. So at times, surgery can also be done. Apart from if the pain, cannot be cured by this kind of drugs and so on and so forth. Apart from this trigeminal nerve neuralgia, somebody may have trauma on the face. During fight, somebody may give you a blow on the face, to the extent that he or she may smash your maxillary bone or may smash your mandible. You get it? So by so doing, somebody may have a fracture on the maxilla or on the mandible. Not only that, somebody may also have what we call temporomandibular dislocation, what we call TMJ dislocation. So we can have dislocation of the temporomandibular joint. So the trauma can cause this fracture of the maxilla, fracture of the mandible, or dislocation of the temporomandibular joint. If you want to really know exactly where your temporomandibular joint is, you now use your index finger, the tip of your index finger, you put it directly anterior-superior to the tragus of your ear, and then you try to close your mouth and clench it like this. Then you try to open and close. So you now feel, you close the mouth like this, then you now open widely. So you are going to feel the movement of that joint. That is your temporomandibular joint. And so that one can also dislocate as a result of a trauma or something like that. So when somebody has a trauma on the face, he or she may also have laceration along the musculature or the skin of the face. You see, the face is well vascularized. That means it has a lot of blood supply. Reason because there are so many structures in the face. There are eyes, there is nose, there is mouth, and in the mouth, there are so many structures in there. And so the face is highly vascularized. There are so many glands in there. And so that is why wound on the face, when somebody has laceration, the face bleeds very well because of high vascularity. Apart from that, the laceration there, when somebody has a cut and also has a cut on any other part of the body, the wound on the face heals faster because of it is much blood supply in there. So anywhere in the human body that has a very vast blood supply, it heals faster than the area that is less supplied by blood. Are you clear? So that is why I said the laceration on the face bleeds very well because of high vascularity, and it heals faster again because of its high vascularity. Are you all clear? Good. So the fracture on the maxilla can also get, if it is an open wound, when somebody has a fracture of the maxilla as a result of an injury, if there is an associated open wound, somebody may have an infection of that maxilla. You know, in the maxilla, there is a hollow space in there, what you call maxillary sinus or antrum of hymo. So that maxillary sinus can get infected as a result of open wound. When somebody has a trauma or fracture of the maxilla with associated wound there, which may likely get infected. Once such wound now gets infected, the infection can now get into the maxillary sinus and can cause sinusitis. Not only that, in normal individuals, somebody that has catarrh, the catarrh, is a viral infection. So when that happens now, because, it affects the nose. And so that infection now can also, because the nose, has communication with the maxillary sinus. So the maxillary sinus opens up into the nasal cavity. And that is why when somebody has catarrh, that catarrh can now affect the maxillary sinus. And that is the reason why when you have catarrh, when you speak, people don't hear you well, because there is involvement of the maxillary sinus, because the major function of this maxillary sinuses, is to aid in phonation. You get it? When you now speak, the speech you are making, people will be able to hear you very well. But once it is infected as a result of this catarrh or inflammation from trauma of the maxilla as a result of fracture or whatever, if it is infected, then there will be that sinusitis, and then the voice will likely be also affected. Similarly, the mandible can also be fractured, and so once the mandible or maxilla is affected, chewing is definitely going to be affected. So the chewing process is definitely going to be, uncomfortable, because once you start to chew, you start feeling the pain. So these are all the things that you people should get to know. And also dislocation of the temporomandibular joint, that joint can get dislocated as a result of excessive laugh. When you laugh too much, at times, occasionally, the joint can get dislocated. Or as a result of trauma, when somebody has a motor accident, or when you bang your head on a very hard object, or when somebody give you a blow on the side of the joint also. There are so many ways one can have this temporomandibular joint dislocation. And so once it is dislocated, the mouth, if it is bilaterally dislocated, the two dislocate at the same time, the mouth tends to remain open. So you cannot close your mouth, so the mouth will be open. You get it? So if you want to definitely make a repair of that, you now put this, you have to glove your fingers, your hand, you put a hand gloves, surgical glove or disposable gloves. So you now use your thumb, two thumbs, the base of your palmar surfaces of these two thumbs, then you now place them over the last molars of the teeth of that patient, and then you press the mandible down. Once you press the mandible down, so you will now push the mandible backward, and then the joint will now go back. It is now going to make a click sound, and that is the sign that the joint is being taken back to its own former position. Mostly the patient is going to complain of pain when you want to make this maneuver. But before that, you can give the person, something like analgesics, paracetamol, either paracetamol injection or tablets, or you can give him ibuprofen or any other analgesics for the pain to subside before you now carry that maneuver. Alternatively, you can also ask the patient to gag a warm water in the mouth. That one can also help in relaxing the muscles, and then you now carry your procedure, because the joint is just being related to the muscles responsible to opening the mouth. This is your lateral and medial pterygoid muscles. I'm sure you must have done this in your head and neck. And so once that joint is dislocated, since they are responsible for opening and closing the mouth, once they dislocate, then the joint now remains, the mouth remains open. And so you do that maneuver, and then you take the joint back into its own position. Similarly, you can also have what we call birth trauma. At times, ladies, they get problem in giving birth themselves. Why? Because the head and the pelvic cavity of that woman, there is, disproportionality. That means the pelvis is not proportionate to the head of the baby. Probably the head of the baby is bigger than the pelvic outlet, or the pelvic outlet is narrower than the head of the baby. That is what we call cephalopelvic disproportionate, what we call CPD. This CPD is cephalopelvic disproportionate, and so by so doing, a doctor can easily use what we call delivery forceps. So the delivery forceps are just like fingers of your hand. So you now put these two forceps into the vagina of that woman. You grab the head of the baby, and then you drag the neck of the baby out of the vagina. And so that is what we call assisted delivery. Not in all cases of this CPD that you do this assisted delivery. At times, if you try it and you are not lucky, you just leave it, and then you can, ask your senior colleague to, review the patient. Probably the patient may likely undergo what you call cesarean section. So that means if this assisted delivery by using forceps fails, then you can now do what we call cesarean section. So you know that when the baby is born, the mastoid process here, which is just a very robust projection just at the back, of your ear. When you now put your index finger at the back of the superior part of your ear, you are going to feel one very big pointed swelling there. That is the mastoid process. In children, this mastoid process is not fully developed. And so by the time you do this forceps delivery, in trying to grab the head of the baby around the ears, you are likely going to damage the facial nerve, because you know that the facial nerve exits from what we call stylomastoid foramen, a foramen that lies between the mastoid process and the styloid process. So the nerve is in between there. And you know that I said that facial nerve supplies the motor, motor nerve supply to the muscles of the face. So once that nerve is been damaged, if the nerve is only on one side, that is okay. The other side is going to be normal. But if it is both sides, the whole face is going to be paralyzed. That is what we call facial nerve palsy. So the facial nerve palsy means facial nerve paralysis as a result of this forceps delivery. Are you clear? So once you have facial nerve palsy, The facial nerve palsy, you know, if you have done that in the head and neck, you know that major presentations of this facial nerve palsy, like the angle of the mouth here sags down. So also the angle of the eye of the affected side also sags down. So you are going to see that this face of one side is going to be paralyzed. The affected side is going to be. So if it is a facial nerve of the right side, that right side is going to be paralyzed, and then you will see that this angle of the mouth is normal, but this one now drags down. So you are going to see that this angle of the mouth sags down like this on this side. Are you clear? So also this eye on this side is going to sag down like that. So there is weakness. You're also going to find some wrinkles of the affected sides. So you are going to see very prominently what we call nasolabial fold. Most of you here, they do have this nasolabial fold, but in facial paralysis, that nasolabial fold on that side is going to disappear. You get it? So the nasolabial fold is going to disappear on the side of the injury, but it's going to be present on the normal side. Are you clear? So these are the features of the facial nerve paralysis or palsy as a result of this. And mostly this is what we call lower facial nerve paralysis, because there is also what we call upper, facial nerve, upper motor neuron paralysis of the facial nerve, because the facial nerve has upper and the lower motor neurons. You will do that in the neuroanatomy, but for now let us just leave it like that. That's also what we call Bell's palsy. The Bell's palsy is similar to the facial nerve palsy that I've told you, but the only difference between this Bell's palsy and the facial nerve palsy is that this Bell's palsy is a viral infection. It's not as a result of the trauma caused by this, but this one is as a result of viral disease. And that viral disease affects the facial nerve, and so the facial nerve swells up and then gets paralyzed. And so you have all the features of this facial nerve palsy, with regard to this Bell's palsy. Bell is a name of a person. That is because he was the one that noticed or discovered this, paralysis as a result of this viral infection. Similarly, there's what we call danger area of the face. Are you clear? Or what we call death area of the face. Death area of the face. This area of the face, what we call danger area, is a triangular area from the beginning of the nasal bridge. If you now put a finger in between your two eyes, that is the beginning of the nasal bridge, and then you now also get a point at your two angles of the mouth, here and here, and then you now join this line. So from here, you now make a line here to come into this angle of the mouth, and then you also drag this line here to come into this angle of this mouth. So you now join the 3 points, and any part of this face here is what we call danger zone area of the face. Why we call it danger zone area of the face is because, if you have an injury there, or you have a boil there, what is boil? A small rash anywhere here, you are not expected to squeeze that boil, or you are not expected to joke with the infection around that site. Reason because if you squeeze a boil around that danger zone, there are what we call facial veins. This facial vein, they drain through on the forehead here now. That's what we call ophthalmic veins. Here below the eye, there are what we call infraorbital veins. These infraorbital veins and the ophthalmic veins, they drain, the facial veins, all of them, they drain through these infraorbital veins, and from the forehead, they drain through the ophthalmic vein, and so they finally now go into the cranial cavity, and so they communicate with what we call a cavernous sinus. So the cavernous sinus, you all know that the cavernous sinus is a sinus, within the cranial cavity, and so it communicates with all other sinuses within the cranial cavity that drain the cerebral hemisphere. So the infection can now get transported through these infraorbital veins or ophthalmic veins into the cavernous sinus, and so the cavernous sinus can be infected. And so the infection can now involve the entire cranial cavity and involve the brain. So once the brain is being involved, somebody may have what we call cavernous sinus thrombosis, because the cavernous sinus, once it is inflamed, the cavernous sinus, the veins in there can get thrombosed, and so it can cause what we call cavernous sinus thrombosis. And that is a very dangerous kind of problem or situation, and so it may likely lead to death of that person if it involves the sinuses, intracranial sinuses, or the cerebral hemisphere themselves. So that is why you are not supposed to, joke with the boil or injury around this danger area of the face. Again, we may also have some congenital anomalies of the face, something like what we call a cleft face. So you may likely have seen some people with a cleft face. So you may find out that there is a tear from one angle of the mouth up to this nose, the beginning of the ala of the nose here. So you can see in some people there is a cut, from this angle of the mouth down to the lower aspect of the nose, or even beyond that. So all this place now is cut open. That is what we call a cleft face. It may likely be associated with cleft lip and cleft palate, and by so doing, that is a very extensive cleft, because it is 3-in-1 cleft. Cleft of the lip, cleft of the face, and cleft of the palate. And so, but at times you may likely have only one cleft of the face. And so if it is only one cleft there, it's very easy. As a doctor or as a surgeon, you can just take the patient into the theater, and then you use your needle and thread, and then you suture, not the ordinary thread that We're talking about the surgical thread, So we use those ones, and then we suture back. And then, the patient will heal, and you may not likely see, the scar in there. So now you can also have tumor of the face. The face can also develop some tumors, especially the tumors of the maxillary sinus. The maxillary sinus can also have a tumor there. The cancer, we're talking about the cancer. The epithelial lining of the maxillary sinus can get multiplied, uncontrollably, so that it can cause cancer there. So the maxilla can develop tumor or cancer. Even the mandible, but the cancer of the mandible is very rare as compared to that of the maxilla. So, these are the, common, conditions or diseases that one can have on the face.